Hi everyone, this is Ms. Romani, and for today's lesson, we're going to take a look at some medical technologies that are used for diagnosing diseases, and these are diagnostic technologies. In this lesson in particular, we're going to take a look at X-rays and CAT scans. So let's start with X-ray radiation, or X-rays. And this is probably the best technology to start with because it's probably the one that you're most familiar with. Every single one of you will have had an X-ray at some point. If you haven't had one, please ask your parents to take you to the dentist because then you are definitely overdue a dental appointment. Because if you go to the dentist, they'll take an X-ray. So you've had an X-ray. Some of you have had maybe more if you had some accidents or some other conditions. So X-rays, what are they? Before we begin talking about X-rays, let's talk about radiation real quick. And so in grade 10, you learned about something called the electromagnetic spectrum, which is basically how we look at light. And light comes in waves, and waves that have different wavelengths. So there's different types of light. This is all review from grade 10, right? So we start with wavelengths that have parts of the light spectrum that have very long wavelengths that don't have a lot of energy. These are radio waves and microwaves and infrared or IR waves. And then we get into the waves that are more narrow, that have shorter wavelengths and have way more energy. And so then we can get into the visible light spectrum. This is the light that we see, then UV light, X-rays, and gamma rays. And so what we're going to focus on are those higher energy light rays, the X-rays and the gamma rays. And so obviously X-rays use X-rays. So they're a type of light that has a very, very short wavelength, so therefore has a lot more energy. And as a result, tend to be a little bit more dangerous to our cells. And we'll get to why in a second. And so when we're talking about X-rays, we're going to be talking about just a type of light. And so essentially, what are X-rays? It's just light, just a very, very high energy light. So let's say you broke your leg and you need to have an X-ray taken. So what's going to happen is we're just going to discharge this high energy light towards the body part that we need to X-ray. What does that mean, discharge? We're just going to shine the light on it, except that it's not light, it's X-rays. So if we were using visible light, it would be the equivalent of just shining a lamp at your leg. But obviously X-rays are different than that because visible light, all it's going to do is make your leg more clear and maybe make it a little warm. But the X-rays are obviously going to go through the leg and they're going to be able to give us an image of your bones. So that's the difference between visible light and X-rays. The idea that one of them actually can penetrate through your skin and your body parts and then give us an image of your bones. And so the way that it works is the X-rays will pass through your tissues, but not equally. See, X-rays can easily pass through soft tissues. Soft tissues are things like skin, muscle, tendons, cartilage, things like that. But they're going to be stopped by the most dense tissue. The more dense tissue are bones and things like teeth. And so when the light is shone, when the X-rays are shone through your body parts, they will go right through, but not through all of the parts, only through the soft tissue parts. Those denser tissues, the bones and the teeth, and maybe if you have like a metal rod stuck in there, all of those things will absorb the X-rays. And so you'll be able to get an image that way. So any areas where the X-ray passes through the body are detected as changes in a piece of film that is placed beneath the body part or behind the body part. Or in the case of dental cavity X-rays, inside your mouth. If you've ever gone to the dentist, that's what we have, right? And they take an X-ray of your mouth. Remember, they asked you to put this hard, very uncomfortable little piece of plastic inside your mouth, and they ask you to bite down and not move. And then they take the X-ray and then they come out and they take it out. Well, that little plastic part that they put inside, that contains the film. That's where the X-ray is going to go in. And so if you look at this three pictures of three X-rays, right? On the first picture we have here, obviously a set of lungs. And you'll notice that it looks really black inside there. Because what are lungs filled with? Air. Air is probably the least dense out of anything that could be within your body. And so, because the X-rays pass right through your lungs easily, because they're so, what's the opposite of dense? They're so light. They don't have as much density. They can pass right through. And so they were able to change and react with a piece of film right behind it, and it turned that piece of film black. So wherever the X-rays pass through your body parts, it turns that part black on the piece of film. And wherever the X-rays did not pass through, it remained white. Now notice that there's an arrow pointing to a little section of the lungs that is a little bit wider. So that's something. That's a pathology. That's something that's wrong in that lung. Normal lungs, healthy lungs, should be all black because they should be filled with air. There's something in that lung that is not air. What is it? We don't know yet. On the middle picture, you see obviously a knee. You see the two bones right there, the femur and the bottom of the leg bones. And you can see there that the bones have absorbed a lot of the X-rays, and so they appear white in the film. But the surrounding area is black. Now, this person who had that X-ray taken is not a skeleton. They actually have skin, and they have muscles, and they have maybe fat and other tissues. But those tissues did not absorb the X-rays. So the X-rays were able to move right through those tissues, and all we can see is bone. And then the third X-ray you can see here is of the digestive tract. This is a section of, looks like large intestine. And you can see that there's white sections, and then there's blacker sections. Now, you might be thinking, wait a minute. Intestines are not made of bone or teeth. So why is it that there are white sections within the intestine? And that's because a contrasting agent has been introduced into the body in order to be able to make that X-ray work. So whenever somebody needs to have an X-ray taken of something like their intestines or digestive tract, they usually will use some sort of contrasting dyes. Sometimes, if you've ever heard something called a barium enema, or you can actually drink it. So then you can actually drink a contrasting dye, or you can have it inserted through an enema, which means that it's inserted directly into your rectum, and then it goes into your colon. And what that dye has is it has a very, very dense element in it. You oftentimes say something like barium, say, and so that provides that very dense element that absorbs the X-rays. So when the X-rays are shown right through, then they will be absorbed by wherever the dye ended up. And if there's any obstruction in the bowel or anything going on in the bowel, it'll just basically show the shape of that, and it will show areas where the dye didn't get through, and maybe that means that there's an obstruction. Oftentimes is poop. So that's how they work, right? Either way, you always will have the denser areas appear lighter, and the least dense areas appear darker. Okay, so let's take a look at some of the uses of X-rays. As you might know already, the X-rays are used to diagnose problems with our bones, so our skeletal system, basically broken bones, dislocated bones, and so on, fractures like that. They can also be used to diagnose what is called soft tissue pathology, so something wrong with tissues that are not hard, like your bones, is soft tissue, like for example, something wrong with your lungs. So a couple of very common uses for X-rays, for chest X-rays, is to diagnose sometimes diseases like pneumonia or tuberculosis, or sometimes even lung cancer. And the reason for that is because, once again, our lungs are supposed to be filled with air, so therefore healthy lungs would appear black, completely black on an X-ray. So whenever you see any pieces of white or shadows of white within the lungs, within X-rays of the lung, then that's a problem. That's something that is wrong. And so on the left-hand side, you can see that there is areas that are black that are good, but then those areas that are sort of shady or shadowy white, those are essentially what pneumonia looks like, which is an infection of the lung. And oftentimes that might be fluid that has been built up in the lung, lung tissue that is not working well, so therefore it's not filling up with air, could be pus or other signs of infection. So right there, that appears as sort of those shadows that are in white, ironically. Now, on the right, you see actually a mass, and that's a lung tumor. So I told you before, we don't know what that is. Well, I knew, but it was a surprise. So that's a lung tumor. And so that appears as sort of a wider area. Why? Because tumors tend to be more dense than the surrounding tissue, especially lung tumors, because they're going to be more dense than the air that's supposed to be in there, right? So abdominal X-rays can also be done for diagnosing soft tissue pathology of your gastrointestinal tract, or also called the GI tract. So you can look for bowel obstruction or some other types of diseases. And usually to do this, like I said before, you need some sort of contrasting agent, oftentimes a barium enema, or sometimes you can take it orally, you can take it through the rectum as an enema, and then that gives you that contrast. It just gives you some very, very dense material that doesn't remain in your body forever. You pass it, you poop it out eventually. But that contrasting material, that contrasting dye, it would allow the medical professionals to be able to see if the shape of the colon, the shape of the GI tract, and if there's any obstruction or anything else going on. Obviously, another main use for X-rays is for dental issues. So when you go to the dentist, you get an X-ray taken, and they can take a look for mostly two things. They're mostly looking for cavities. Cavities appear obvious in X-rays because cavities are basically areas of the enamel of the tooth that have been eroded by bacteria. And so teeth should appear white under an X-ray because they're very dense. But if you have any areas that are a little bit less dense, those will appear as sort of not as white, so darker areas, and that indicates a cavity. Also, the X-rays can give an indication of where the teeth are, the shape of the teeth, the shape of the roots. You can check if you have impacted teeth, teeth that have not come out yet, that are stuck in the bone, teeth that are coming in crooked, and so on. So it gives you a lot of information about tooth growth as well as cavities. So let's talk about now the risks of X-rays. And so obviously the main risk with X-rays is something called radiation exposure, because X-rays are a type of radiation. They're a type of light ray that has a very high energy wavelength, which can cause damage to DNA. And so that's the main idea with why we protect ourselves when we get an X-ray taken. You always are given some sort of lead covering, so either a bib made out of lead or sometimes a little blanket made out of lead. It's very heavy, and the reason for that is because lead is very dense, and so X-rays cannot pass through lead, and they will protect anything that is covered by that lead material. Now, before you get all upset about the last time that you got your X-rays taken at the dentist, the amount of radiation that we're exposed to when we go to a dentist or get a chest X-ray taken, or our leg X-ray done, is very small. We are always exposed to a certain sort of level of radiation just living in the world. Everyday activity exposes us to just a particular level of radiation. And certain activities will increase that radiation exposure. Like, for example, if you decide to take a trip and you take an airplane ride, going through an airport and flying actually exposes us to quite a bit more radiation than we would just by staying home. And so if you take a moment, if you're interested, you can pause this slide and you can take a look at this chart that I put there, and it shows you the amounts of radiation exposure that are considered to be dangerous and then even fatal, and it gives you examples of what types of situations would expose you to that level of radiation. And you will find that dental X-rays and chest X-rays and other sort of diagnostic X-rays are right at the bottom there. We don't really get exposed to that much radiation. The people that are most at risk are basically people who are not yet born. So unborn babies are at a greater risk of radiation, not because the radiation is going to be more damaging to them, but because they don't have as many cells that can be damaged. So your body has over 1 trillion cells. So if maybe one of them by chance gets a little bit of UV damage, radiation damage from X-rays, your body can deal with that. Your immune system usually gets rid of those cells that get damaged. The cells destroy themselves. There's a lot of checks and balances that our body does so that we can avoid, every little mutation becoming something dangerous. Our body accumulates mutations constantly. But if you are an unborn baby and you might only have a few cells, having one of those cells damaged, that can be a big deal. This is the other reason why whenever you go get an X-ray taken, they always also make sure that they cover the area of your body where you're either going to be carrying a baby or even the area of your body where you're going to be producing eggs or sperm, because it's not just exposure to a fetus or an embryo that is a problem. It's also exposure to eggs or sperm, because if eggs or sperm accumulate mutations, then those can be passed on to future generations as well, right? The other concern is also for X-ray technicians. People who actually work a lot with X-rays are going to be more concerned than you, the patient. A patient will be exposed to X-rays very seldom, but somebody who, say, takes X-rays 5-10 times a day, every day, 8-hour shifts for months and years, they're the ones that need to be concerned about X-ray exposure. And even they themselves are not exposed very much, but as a precaution, they usually will have some sort of device that basically measures their exposure to X-rays, and then that gets checked. I believe monthly or something like that, and it just they can keep track of that. So there's a way for them to keep track of that so that they're not exposed to. But even for individuals like that work with X-rays, they're not exposed very much because, as you noticed, every single time you go get an X-ray taken, they always leave the room. So they're not in there with you while you're getting your X-ray taken. They leave the room so that they can minimize their exposure. And the only way that they would probably be exposed is if they don't follow a protocol or if there's an issue with the machines. So I'm gonna move on to the next topic real quick, and that's very related to X-rays, and those are CAT scans or CT scans. And the reason why I have this topic right after X-rays is because they're very much related. CAT scans are basically a diagnostic technology that uses X-rays to that are combined using computers in order to create a 3-dimensional or cross-sectional view of a body part. I really like this picture of a CAT scan. It's so cool and pretty gross. I mean, it is literally like looking through the top of someone's head that has been chopped off, but it hasn't been chopped off. They just had a CAT scan done of that section. And so that's what a CAT scan does, or a CT scan. It allows you to take a look at a cross-section of a person's body. And so rather than having a doctor, maybe cut through the top of someone's head to see if they have something wrong with their brain, say, which would be ridiculous because then that would kill the person, so defeats the purpose, we just take a CT scan and that gives us pretty much the same view. So as you can see right there, you can see the brains on the back, you can see the 2 eyeballs, and you can see the nose and parts of their ears. Anyway, this is just taken by X-rays, but X-rays are 2-dimensional. The X-rays that we just discussed before, they're very 2-dimensional. It's just basically a light passes through the body part and you get an image on a film right underneath it. How can we get this cross-sectional 3-dimensional view? And that is simply by combining hundreds of X-rays together, and then a computer just combines those images and puts them into this 3-dimensional picture. And so CAT scans or CT scans allow a doctor to then see inside the patient or is in the body using a 3D image of the internal organs. Pretty cool. So in this animation, we can actually see how an X-ray machine works. It is going to focus on a body part, and what's going to happen is you're going to place a film underneath the body part and in between the body part and the X-ray machine, and the X-ray machine is just going to shine the light. The light is the high beam X-ray, which is then going to go through the body part and hit the film, and the film is going to change color depending on whether or not the tissue was dense. And a CAT scan is just the same machine, except that now it is placed inside this rotating ring, which can then rotate around the body and in the process take hundreds of pictures as opposed to just a single one that was taken with an X-ray. And when that happens, a computer can then gather those pictures and create a three-dimensional image of the part of the body that was just scanned. All right, so let's take a look at the uses of CAT scans. A lot of the times CAT scans or CT scans are used for head scans. Oftentimes when somebody has had an injury, they can easily check for bleeding in the brain. They can look for skull fractures because the skull is very difficult to view skull fractures using an X-ray because it's very two-dimensional. So the three-dimensional structure of the CAT scan can better allow us to look for skull fractures. And it can also detect cancers or brain tumors. They're not as good as MRI scans. I'm going to show you MRI scans next at detecting brain tumors, but they're useful for that. But a lot of the times, just for something like, say, a concussion, you're checking to see if there's bleeding in the brain. If somebody has had maybe a stroke, you're looking to see if there's sort of any kind of bleeding in the brain from that. A CAT scan or a CT scan is a great tool for that. Oftentimes you can also do chest scans. They're looking for lung problems like cancers, emphysema, pneumonia, embolisms. Embolisms are like blood clots in the lung. You can look for, you can do an abdominal or a pelvic scan. You can look for renal stones, which are stones that you can find in your kidneys, appendicitis. You can look for cancers, and so on. So there's a lot of different things that we can look for. And you can see here there's a variety of different CAT scans that I have showing you. For example, at the very top, we just go to the top left, you can see a CAT scan of appendicitis. You can look at a skull fracture at the bottom. You can see some kidney stones. There's some lung cancer there. You can see a brain hemorrhage at the top right. The hemorrhage means like bleeding in the brain. So the bleeding appears, as a more dense area in the brain. And on the bottom right, you can see a brain tumor. So a variety of different pathologies can be seen using CAT scans as long as there is a contrast in density. So as long as you can kind of look for a difference in density, remember we're still using X-rays, so it's not going to be as great at looking at soft tissue density differences, but it's definitely much better at doing that than simple X-rays are. But is not as good at detecting differences in soft tissue pathology as MRI scans are. MRI scans can detect more subtle differences in density, whereas CAT scans are much better at detecting very dense things in some less dense tissues. So, for example, problems with the lung, you can see the lung cancer there. They can easily look for skull fractures. They can look for stones, bleeding in the brain, or tumors. Those are easily detected because those areas, those tumors, those stones are very, very dense. The risks of CAT scans or CT scans are pretty much the same as the risks of X-rays. You're exposed to the exact same high energy photons as you are with X-rays, but you're exposed to them in much greater quantities. So a CAT scan, like you saw in the video, it's hundreds of X-rays taken simultaneously. So obviously the risk is a little bit higher because you're having a lot more of these X-rays taken at once. So exposure to X-ray radiation is higher than regular X-ray, but still relatively low. And obviously with any medical procedure, there has to be a weight of the risks versus the benefits. And often most of the time for the CT scans and X-rays, the benefit of the scan in terms of diagnosis outweigh the risk to the patient in terms of their exposure to radiation. Sometimes the contrast agents and the dyes that are used for both X-rays and for CAT scans, they can sometimes have side effects. So it's actually more common for people to have an effect from the CT scans as a result of the contrast dye agent. And this is not often. It's just that sometimes people can have allergies from them, or they can make them feel nausea or discomfort from just taking the dye. And that's it for this lesson. Tomorrow's lesson or the next lesson, it's going to focus on some other diagnostic technologies, starting with magnetic resonance imaging or MRI scans. Talk to you soon. Bye.